Welcome to The Real Heal, a show featuring real, raw, and authentic conversations between experts in the holistic health space. I am your host, Dr. Renee Wallenstein, also known as the libidoologist, double board certified doc, entrepreneur, as well as healthcare disruptor. So if you're ready, let's get into it. All right, well, welcome. This week, we're actually going to talk about perimenopause. And interestingly enough, I put a little poll out on both of my social media channels, Instagram and Facebook, and asked if any of the women in my community had a question about perimenopause. And I'm telling you, I got a ton of questions ranging anything from, symptoms and, and then treatment, natural treatment, conventional treatment. So I thought that we would break this into a couple of different podcast episodes. And as I'm recording this podcast, it's also going to be on YouTube. And I am streaming live on TikTok. And today we're going to actually go through some of the symptoms, because if you're a woman in your mid to late 30s and 40s, you might be experiencing some weird symptoms. What about moody, bloated more days than not out of the month. You may feel a little foggy as far as your brain goes, like that you're not as sharp as you used to be. You might not be sleeping well. You might have some new aches and pains. And you're wondering, like, is this perimenopause or is this something else? Now, it could be something else. However, if you are in the age range of mid to late 30s and late 40s, it could also be related to perimenopause. And ironically, as we're going to talk further in this episode, some of your symptoms actually may worsen because of the hormonal fluctuations during menopause. So perimenopause, what exactly is it? It is not just one little snapshot in time. It is a process. Okay. So it's not just one single event. It's a process in a woman's life that could range in time anywhere from 2 years up to 12 years. And this is actually the stage in your life where your period has not quite stopped yet. Okay. When we hit menopause, that's really when it stops. So this is the period of time before then. And, when we think about it, ladies, perimenopause and menopause can comprise almost half your life. So it's really important that we actually talk about it. So let's see. I want you to understand, before we get into the symptoms, that these symptoms are temporary. They're not permanent. Okay. The process along the way is in these symptoms, and whether or not, sometimes during the month they're worse and sometimes they're better. It is all due to hormonal fluctuations. Okay. And we, can't take this process of anywhere from 2 to 12 years. The hormonal fluctuations differ. And so one key takeaway that I want you to know, as you may experience some of these symptoms, that, yes, they may be related to perimenopause, but it could be something else. And this perimenopausal time, unfortunately, is a really critical window whereby sometimes these symptoms, if we don't snip it in the butt and take care of them, they could be a bigger problem once we enter menopause. All right. So, it's a really good idea as we go through some of these symptoms, if you're experiencing them, and in future episodes, when we talk about treatment, if you had these problems before this stage of your life and they're getting worse, maybe it's sort of like a wake-up call to intervene and do something about it before it gets a lot worse. Okay. So let's talk about the two main female hormones, estrogen and progesterone. Okay. Estrogen, we're focused mostly here on estradiol. This is our main, one of our main female hormones. So when I talk about why it's important, you're going to have this aha moment that when we enter menopause, which we're not talking about menopause today, we're talking about perimenopause, but when we hit menopause, why you might experience some symptoms from lack of this hormone. So estrogen is really important for building muscle, maintaining the heart and brain health, maintaining a healthy metabolism, allowing you to lose weight, especially around your midsection or your waist. It enhances your sensitivity to the hormone insulin, and it can actually act as a normal natural appetite suppressant. Some of the not so great things that it does, but it depends on where in your life you are and what function of estrogen you're looking to use, but it does stimulate the uterine lining, and this is super important when it comes to pregnancy. Not the best thing when we're talking about perimenopause, when it's not counteracted by that progesterone, and it can also stimulate the breast tissue. So you can see here that as we enter the perimenopausal years and we have fluctuating levels of estrogen and maybe a little bit less progesterone, this is why we get our heavy periods and maybe breast tenderness, because of the higher estrogen levels. On the converse, progesterone. I always like to say progesterone is our calming hormone. So this is the hormone that we actually produce from the follicles. So from those little eggs that we develop every month, they produce progesterone. And so this progesterone counteracts estrogen at the level of the uterus. So it thins your uterine lining, which is why we get that withdrawal bleed at the end of beginning of every cycle, I should say. It helps calm your brain. It can lower your feelings of anxiety or anxiousness, and thus can help with sleep. Okay. So I always say estrogen and progesterone are like yin and yang. We want our estrogen because it keeps our tissues nice and supple and it keeps our heart and brain healthy. But when estrogen's left to its own vices without the counteraction of progesterone is when things can get a little bit out of control. And when we start losing our progesterone is when further symptoms start developing. And also, progesterone helps lower inflammation. It helps, again, also protect your heart, support your immune system, and also helps with metabolism. So we see how these two hormones work synergistically together to support each other. They're the perfect sisters, with the role of giving you a healthy menstrual cycle, allowing you to get pregnant. But when the hormone levels start getting a little out of whack is when we start feeling not quite ourselves. So I like to talk about perimenopause in that it is a lot like puberty. So when we start going through puberty, we have our estrogen level increasing as well as our progesterone level. On the converse, when we're going through perimenopause, in the early parts of perimenopause, we have very high and low levels of estrogen. They're fluctuating really, really high, really, really low. However, throughout the phase of perimenopause, we get progressively less and less production of progesterone. Okay, so this is when we're going to start experiencing, again, our heavy, irregular periods, just like when you were 14. So if you feel like you are revisiting puberty in perimenopause, you're right, you are. Okay. And you can also start experiencing, some things that you also had in puberty, maybe some breast tenderness, maybe some irritability. And just know, like I said earlier in this episode, it is not forever. When you hit menopause, a lot of these fluctuations cease. We enter a new transition in our womanhood, and a lot of the symptoms that we associate with perimenopause stop. And of course, one of them is your irregular heavy periods, and those extreme mood swings tend to get better. Okay. When we're thinking of other things, yes, you can feel more fatigued with perimenopause. You can be, extra achy and have some pains. While that may be a part of perimenopause, it could be something else. So if you're experiencing worsening pain or worsening fatigue, you definitely don't want to just chalk it up to perimenopause. You definitely want to go and have those symptoms checked out. Okay. So let's talk about why we make less progesterone as we go through perimenopause. So our ovaries are still producing a great amount of estrogen, sometimes even more so from other mechanisms, which we'll talk about in a little bit. But our eggs, our follicles in our ovaries are getting older. Those are the structures in our ovaries that are making our progesterone. So as we get older, we're, number one, running out of the number of eggs, but the quality of eggs or our follicles is decreasing. So what that means is every month when your brain tries to recruit an egg to ovulate, this is what gives us our normal cycle. Okay. First of all, we're running out of follicles. So there may be months in perimenopause that your ovaries are like, sorry, there's not a follicle this month to ovulate. Sorry, we're running low here. So you don't ovulate, which gives you an irregular heavy period and a low progesterone because you didn't ovulate. And when you ovulate is when you have something called a corpus luteum, which is where the egg came from. So even though the egg falls away and if it's not fertilized, we don't get pregnant, we still have this structure called the corpus luteum that produces progesterone. This is the key structure here. So there may be months where we don't ovulate, we don't release the egg, thereby we don't produce this corpus luteum, thus we don't produce the progesterone. Or if we do ovulate, we actually may not produce as much progesterone because the egg quality is not as good. Okay. So even if you do produce the egg, lower progesterone levels, we're still spewing out a ton of estrogen, but we're not counteracting that with the appropriate amount of progesterone, which gives us a lot of our symptoms in perimenopause. And we do this month after month. Okay. So now what I do want to sort of make the differentiation here between is that I'm not talking about surgical menopause or medically induced menopause. And what those are if you have your ovaries removed, usually as part of a hysterectomy, that is an abrupt menopause. That is called a surgical menopause. A medically induced is usually from something like a chemotherapy for cancer treatment. A lot of times those interventions will shut down your ovaries. And so both of those scenarios will actually give you a more abrupt onset of symptoms and may actually call for different treatment than what we're going to talk about in the future. What I'm talking about here is natural perimenopause into menopause. You can actually undergo a natural perimenopause also if you have your uterus removed. So if you have just a straightforward hysterectomy and retain your ovaries, you are still cycling. You just don't have a monthly bleed as an indication that you are cycling. Okay. But you're still undergoing all of the same hormonal changes. You're just not getting that physical determination of a period. And it does make it a little bit harder. As far as determining whether or not you're in perimenopause, you may have gone to your doctor and said, hey, I think I'm in perimenopause. And be like, okay, great. And you're like, okay, are you going to give me a blood test? And they're going to say no. Why? Well, the only good time to really determine your status of cycles is when you're in menopause. What I mean by that is there is a hormone that comes from your brain, your pituitary, called FSH. And it actually stimulates your ovary to produce follicles and release the egg. As you get on in the perimenopausal stage of your life, your ovaries, I like to say they stop listening, or they don't listen as well. They're like a kid. Okay. They don't listen as well because you're running out of follicles. You're running out of eggs. And it gets harder and harder for your brain to convince your ovary to ovulate. And in some cases, some months you may not ovulate, in which case, if your doctor was to check an FSH level that month, you may have a slightly higher FSH level because your ovaries were not listening very well. Versus other months where your doctor might check again and your FSH level is completely normal because your ovaries did listen. So what I kind of want to go back and sort of reiterate is that the hormone that comes from your brain to stimulate your ovaries, the more your ovaries don't listen, which happens more and more the closer you get to menopause, the more your brain has to work to put this hormone out to try to convince your ovaries to release an egg. That's all your brain cares about. Your brain just cares about releasing that egg. We're here to procreate, right? So when your ovaries become more and more resistant, the brain has to put out more of this FSH. So the level will be higher. You may not necessarily see this in perimenopause, which is why a lot of docs don't check it, which is why in the past I wouldn't check it, because you could have all of these symptoms and I check your FSH and it's completely within normal range for your cycle. And I could say, it's normal. And then you're like, okay, so where are my symptoms coming from? Doesn't mean you're not in perimenopause. It just means that currently your ovaries are intermittently listening. And remember, when we go back, you still may in perimenopause have regular periods. You might start having some of these other symptoms though, but retain your normal periods, in which case your FSH is still going to be normal. Your FSH will not be high until you enter menopause. When your ovaries are like, we're done, we shut down, we're not listening anymore. Again, your brain's going to try to convince them over and over to produce an egg, and they're done. Okay. Only then will it be a reliable marker of the fact that you're done. On the converse, there can be a time that your doctor checks your FSH when you're in perimenopause and your FSH is high, and they're like, "Oh my gosh, you're done. You're done. You're not going to have another cycle." And then next month, guess what? You have a cycle. Then you think your doctor lied to you. Meanwhile, they were just giving you feedback that yes, your FSH was elevated, but that just could have been a month, 2 months that you didn't have a period. Your ovaries weren't listening. Your brain was still working to get those ovaries to listen. And then your ovaries finally listened and you had a period. Okay. Remember, menopause is 12 months without a menstrual cycle. So if you are on month 13 and you get a menstrual cycle after not having it for a year and you're of that age of menopause, then it's called postmenopausal bleeding and you definitely should see your doctor. Okay. If you go 3, 4, 5 months without having a period and then month 7, you get a period, you're still in that perimenopausal stage, but you still should check with your doctor. Okay. So I kind of just want to reiterate this also, that the perimenopausal phase is a time of your life. It's like this little critical window where you're even more vulnerable to long-term health consequences. And what I mean by that is that these hormonal fluctuations that we encounter, these really high and low estrogen levels and the lower progesterone levels, they have a huge impact on your overall physiology, your overall biology of your body. And what I mean by that is you're more prone to developing heart disease in the stage of your life, because what estrogen does, estrogen makes us more insulin sensitive. And so when we start having high highs and low lows, we are actually more prone to what they call insulin resistance. So we can't handle our blood sugars as well. Okay. Number 2, our immune system's a little weakened. Estrogen and progesterone are huge supports to our immune system. So while our immune system's trying to figure out these fluctuations and everything that's going on, it's a little weakened, and you're more prone to autoimmune conditions. The most common one is thyroid, Hashimoto's in your thyroid. So, we want to keep that in mind too. So if you start developing, again, some of these symptoms of perimenopause can also sound like thyroid, get it checked out, because if you have an underlying autoimmune condition in your thyroid, you definitely want to jump on it in the perimenopausal years, because it's only going to get worse as we get older. Okay. It's also a super risky time for your brain. There are transient brain changes that occur, again, because of these hormonal fluctuations. Your brain is trying to get used to all these like estrogens ups and downs and lower progesterone. And down the road, it could set you up for things like dementia and Alzheimer's. So we really want to be proactive if you start having any major symptoms during this time of your life, to check with your doc, because we don't want to take any of these symptoms lightly. Okay. So you might be questioning like, okay, so yes, and I have not gotten into the specific symptoms yet, because there's a lot of background information here. And, one thing I want to sort of go over is like, you can say, well, my friend didn't have perimenopausal symptoms or enter menopause. She did it seamlessly, and I'm having a hard time. Number 1, genetics can play a part here. So ask your mom, ask your sisters about their menopausal transition. Chances are you will be very similar to them. But on that note, I also want to put that you are not your genetics 100%. Your genetics a lot of them are expressed based on the environment you put them in. And what I mean by that is based on your lifestyle, diet, exercise, stress, sleep. So if you have genetics whereby your mom's had a terrible perimenopausal phase of her life, and your sisters, also your older sisters, and you're like, oh my God, no way, this is going to be me. It could be. However, if you clean up your nutrition, you make sure you get adequate sleep, you manage your stress levels, you move your body, you actually have a better chance of having a better perimenopausal transition than your siblings or your mom. Okay. So again, the message here is, yes, there is a genetic component, but you're not destined to your genetics. They are modifiable based on how they're expressed based on your lifestyle. Okay. The next thing I want you to just sort of kind of going back to the fact that this perimenopausal stage is sort of the critical window. I want you to also, when you're looking at your symptoms, I want you to sort of look at it as, okay, this is an overall, like a barometer of my overall health. Okay. It could bring light to some underlying issues that you already have going on that now you're a little more in tune to, because you heard Dr. Renee talk about it on her podcast about perimenopause. And now it's like, ding, 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 ding. But I want you to actually think about it in this context. Say that you are, you start gaining weight around the middle. Okay. And you might actually have already been, even though now, because of the fluctuations of hormones, you're a little more insulin resistant. You may have actually been a little more insulin resistant prior to now. If you started gaining weight a couple of years back and now it's just getting worse, especially around the midsection, I want you to ding, ding, ding. Maybe I'm having issues with my insulin sensitivity, and maybe I should make some changes to my nutrition so I can actually counteract some of those changes that are occurring naturally in my body because of the hormonal fluctuations, and get a control on my blood sugars, and subsequent heart disease risk, right? Do that now. Okay. The same with sleeping. So say you have a years of not sleeping well, but now it's even worse, right? Oh, got to be perimenopause. But wait, I had sleep problems before because I can't shut my brain off. Ding, 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 ding. Maybe you have an issue with your stress all along. And this is just your wake up call to sort of get a handle on it before, number one, your perimenopausal symptoms get even worse. But number two, it erupts into something bigger in menopause. Okay. The other thing I want to say is that if you have had kind of seamless periods throughout your cycling history, you probably are going to have an easier time transitioning into menopause. If you have been struggling through your years of having your menstrual cycle, periods and cramps and heaviness, you probably are going to have a little bit tougher time in perimenopause. And now this is not a hard and fast. Like I've had patients in the past that have had terrible periods, and then one day they wake up and they never have another one. Well, in retrospect, that was their perimenopausal stage, right? But, if you've had seamless periods, not too much mood changes, they've not been too heavy, too long, tells me a couple of things. Tells me that your body's adjusting to the hormone levels, ups and downs, just fine. And you're probably breaking down your estrogens pretty well. On the converse, if you're not doing that, you might have a little bit of a harder time breaking down your estrogens. And again, some of that could be modifiable with gut health, liver health, and all the things. Some other maybe from genetics, but again, it's not a hard and fast. You're not going to be able to break down your estrogens well because of genetics. There are things you can do. Okay. But again, if you've not entered perimenopause yet and you're listening to this and you say, oh my gosh, my periods have been terrible. Well, maybe this is a wake up call that we should make sure we're breaking down our estrogens as well as we can. And that, again, focuses on liver health and gut health and a lot of toxins that we're introducing into our bodies. So the things that we can control. And, the adjusting to the hormonal fluctuations, again, a lot of it comes down to how are you sleeping? How's your stress level? How's your overall nutrition? Okay. So there are things that you can definitely do. The moment you've been waiting for. So what are some symptoms that, I kind of breezed over some of them already, but definitely sleep issues and mood changes. As I said earlier, progesterone is our calming hormone, and it helps us keep stress at bay. And so when the progesterone is lower, as in perimenopause, you're more prone to anxiety, as well as depression, maybe some memory loss or memory changes, not sleeping as well. And then and on that note, if you don't sleep as well, this could cause you to be a little more achy and a little more moody, right? Because you're not sleeping as well. And if you had mood changes prior to this onset of perimenopause, there's a good chance that your brain is actually a little more sensitive to the hormonal fluctuations, and your mood changes could be even worse in the perimenopausal stage. And I don't say this as like a Debbie Downer. I say this as like, okay, let's empower you to do something about it earlier in the perimenopausal stage as opposed to later. Okay. Hot sweats and night sweats, or hot flashes and night sweats. So these, a lot of people think that these are just like exclusive to menopause. No. It is definitely perimenopausal as well. The thing is that earlier in perimenopause that you experience them, the longer that it's probably going to last. So if you are experiencing hot flashes and night sweats later in your perimenopausal transition to menopause, and average age of menopause is around 50. That's not a hard and fast, like, okay, 50, I'm going to be menopausal. No. I've heard 55, 56-year-olds still having cycles. Okay. So it's the average age. So I don't want to be a Debbie Downer and say, okay, I'm 40, I'm already having hot flashes. Your transition could be a little bit earlier. Okay. And they could range from just feeling a little warm to a red and flushed face, downright sweating with feeling like your skin is burning. You could feel dizzy, you could feel nauseated, you could experience heart palpitations. They can last anywhere from like seconds, like 10 seconds to minutes. And you can have like one every couple of days to several in a day. So wide range. And again, they're not an indication necessarily that you're in menopause. They're definitely a perimenopausal symptom. They could also be a thyroid symptom. So just a little, caveat there. And what they think, they don't really know what this is from, but they think it's your brain has this really, I don't want to say narrow, it gets narrower as you enter perimenopause, but this, what they call the thermoregulatory mechanism, whereby like it regulates your body temperature to a certain degree amount. It's a little wider before perimenopause. And because of the effects of estrogen, these extreme highs and lows of estrogen, they think that this little thermoregulatory mechanism is actually really narrowed to the point where your body cannot fluctuate its temperatures without having an all-out literal meltdown. So there's that. And then there's also, there's an effect of estrogen on serotonin, these neurotransmitters, adrenaline and serotonin. So serotonin is it's our chemical that makes us feel happy and relaxed. Adrenaline is our stress hormone. So the effects of estrogen on that come into play with thinking that stress might also have some sort of play when it comes to hot flashes and night sweats. So while there's not a ton to do with that mechanism, that thermoregulatory mechanism in your brain, if it comes down to also being related to stress, perhaps managing your stress can help with your hot flashes and your night sweats. And again, we're not talking about treatment in this episode. We're going to talk about treatment in future episodes. But again, heart palpitations, you might feel like they're related to your hot flashes or night sweats. They may be completely a separate symptom. They are probably due to that progesterone, the lower progesterone. Again, remember, progesterone is what keeps us nice and calm. Okay. Migraine headaches. I have a lot of women that complain of new onset headaches during perimenopause. Again, it's from the high, low of estrogen. So these huge fluctuations, the brain sensitivity to these fluctuations, and then the low progesterone. We talked earlier how the immune system becomes weakened because of the changes in the hormones, more prone to autoimmune diseases like thyroid, namely Hashimoto's. We talked about the fact that estrogen helps thicken the uterine lining, and that's great when you want to get pregnant. But when you have really, really, really high estrogen and really, really low progesterone, which is what thins the uterine lining, you could end up with heavy periods, crampy periods, irregular periods, because again, the regular periods are brought about by releasing the egg every month, ovulating. And when you stop doing that, because we're getting older, all bets are off as far as having a regular period. Okay. Breast pain, generally the breast pain from a high estrogen is in the front of the breast, not along the side or in the armpit. So if you're having breast tenderness, like in the front of the breast, that is probably from a high estrogen. If you're feeling really irritable, like on the verge of being like a little ragey, that is most likely from a high estrogen, perimenopause, perimenopausal high estrogen levels. And a really interesting one that I don't know if a lot of people, actually, or not a lot of women know about this, and it's actually something I used to hear a lot from my postpartum women, is that they have new onset of allergies. And this is because estrogen stimulates histamine. Histamine is what causes the symptoms of allergies. Okay, the nasal congestion, the runny nose. And unfortunately, histamine also stimulates your ovaries to make more estrogen. So it's like this vicious cycle of like the really, really high estrogens of perimenopause stimulate histamine, give us a runny nose and congestion. But then these really, really high estrogen or histamine levels feed into the estrogen cycle as well. So really vicious cycle. Just know, and again, we're going to talk about some of the treatment options in the future, but just know that this is not forever either. As soon as those really, really, really high estrogen levels come down, your allergy symptoms are probably going to be improved. Okay. And aches and pains. And I actually got a question specifically for aches and pains on Facebook. Someone was asking about that. And actually it could be from the lack of sleep, the sleep disturbances that we often experience during perimenopause, but it could also be like an old injury showing its ugly head again. Okay. Or like maybe some new onset back pain. And again, this could be something completely different. So just because you're of the age of being perimenopausal, check it out. But you could have new onset aches and pains. And they think it's because of the loss of the anti-inflammatory effects of both progesterone and estrogen. Both of them, again, help support your immune system. They both act as natural anti-inflammatories. So again, the loss in the fluctuating levels of these hormones make you a little more prone to aches and pains that you didn't normally have before. Okay. So I hope this helped. Again, it was sort of like all over of like, what is perimenopause? I do want to sort of raise the awareness that this is a really critical time in your life, that if something does start popping up really, and again, I think a lot of women I work with at the age of, 30s, 40s, even 50s, they use perimenopause and, usually it's weight gain as a time to start changing their lifestyle. And I think that's so smart, because this is again, a critical window whereby if we don't take hold of some of these symptoms, they're going to blow up and be even more of a problem in menopause. And I also want to sort of, again, this is not like a, woe is me, like I'm losing my hormones. There are options, and we're going to talk about them in future episodes, but a lot of these symptoms will improve as we transition into menopause. After all of these crazy hormone ups and downs that we experience, they will get better. And I'm going to actually give you some treatment options, both conventional and natural, that you can try in the future. Again, I'm not your doctor. Always check with your doctor, but things that you might want to try to help with some of these symptoms and see if they get better. Okay. All right. So we'll see you back and we'll start talking about treatment next week. Well, I hope you enjoyed this episode of The Real Heal and that you learned something new. And before you go, can you do me a quick favor? Take a screenshot right now and share it to Instagram and tag me so I can celebrate you for taking action and improving your health. And if you're enjoying this podcast, please take a minute to leave me a rating and a quick review. This will help others just like you find the show. And do not forget to subscribe, because you will not want to miss out on any of the amazing guest experts that I have coming up very soon. And remember, it's not selfish to take care of yourself. Do one thing today that makes you happy and learn to love life again. And with that, I'm out of here. Talk to you again soon.